The greatest reward of my job is to see this incredibly skilled team of rehab professionals come together with one goal. How can I make this patient better?
We just recently worked with a patient that was hit by a car. The injury is pretty severe, and they gave the dog a 5% chance of walking. I might tear up because the dog walked out of the hospital. Within the hospital, when you think rehab, everybody's thinking huge obstacle courses, high-end agility dogs, and dogs that we're getting back to showing, those sorts of things. And there's certainly that component, but rehab is also feel-good things. How do we help with pain management? How do we make a dog more comfortable so they're better able to go for walks or get up from the floor after taking a nap?
Our rehab department here at CSU is different in that it's physical therapy based. I see my patients through the lens of what are their functional limitations? Do they need assistive devices?
I think what makes CSU special is all of our specialty services that we collaborate with.
From oncology to orthopedic surgery to internal medicine, will identify the medical side of the patient's care, but that the pet still has a functional mobility limitation.
He got diagnosed with oral melanoma. He had a tumor on the back of his tongue. Ended up getting chemotherapy. He had both his ACLs operated on. We wanted to make sure he didn't regress.
He definitely got stiff and it got atrophy. And so we were like, okay, physical therapy. We've seen it work for him with these surgeries in the past.
And CSU did a really good job of letting us know it's so many different departments and different disciplines. They encouraged us to reach out to other departments while we were here getting him treated with oncology.
What are you saying? Just so comfortable here. Like everybody knows Kuma.
Every patient deserves an independent, customized, evidence-based program.
We have a wide range of modalities here, things like therapeutic laser.
The light travels into the body and can help speed up tissue healing.
Ultrasound.
The sound waves can do two different things for us. If we put the parameters low, they can push swelling out of the way. If we put the parameters high, it can heat muscles so that it helps us stretch.
We use TENS units.
This can treat muscles, for example, in a dog who has paralyzed legs. You can see I'm still smiling. It doesn't hurt.
Vibration plate.
I just turn the box on. It makes the plate oscillate. The shaking inside the body helps to treat pain by affecting mechanoreceptors, and obviously can help move fluids inside the body.
Magnet therapy.
You can see the magnet wiggle. So that field is moving through the pet's body. This is sometimes used for swelling.
Then we have a bunch of manual techniques that we can do with our hands, stretches, different massage techniques. We have an underwater treadmill. We have therapeutic exercises. So a bunch of different tools at our disposal.
For rehab here at CSU, one of the most important relationships we have is with our referring veterinarians. Here in this department, we do not diagnose, we do not prescribe medications. All medical care is referred back to the referring veterinarian. And our job is to manage the functional limitations of the pets that they send to us. My favorite parts of my job is when I go up to pick up a patient for a reevaluation and the dog sees me coming, and they get a little sad because I'm not their regular rehab girl. That's perfect for me because it means that the team has created the environment that supports the healing of the pet. And when we take ourselves out of the equation individually, really incredible things happen. And that's what I'm most proud of in the work that we do here.
It's not just making the animals better, but it's that relationship with the humans too, because that's where the value is. You see, I've improved the quality of this patient's life, but then the person that loves them at home also sees that, and it's such a rewarding experience.